healthcare is one of the most valuable commodities that human beings possess. We need, as a responsible society, to do everything we possibly can to make sure the resources are available, to do our best to maximize people's health and people's well-being. Hello, I'm Dr. Justin Needle, and I'm the Programme Director for the MSc Health Policy Programme. In the real world, we are faced with limited resources, scarce resources. In many countries, of course, the resources are extremely scarce. As policymakers and governments and decision makers, we need to make sometimes quite tough decisions about healthcare. The MSc Health Policy really is designed for any student who can display a real strong interest in health policy. And really what we're talking about when we're talking about health policy is the ways in which we can improve healthcare, improving access to healthcare, equity in healthcare, efficiency, better ways of funding, financing, and evaluating health services. And that's really what we try to focus on in the course. After my PhD a few years ago now, which was in philosophy, I worked in publishing, legal publishing. I've published in a number of areas over the years, but at the moment my interest is in digital health, delivery of mental health care remotely. I'm currently working on a research project on ways of making the remote delivery of mental health services via video and telephone more effective. A lot of people have issues with seeing their therapists and their clinicians via video call, so it's very important that we make every effort to tailor and to understand the needs and concerns of different service users. There are 4 core modules in the programme, and these introduce the key issues in health policy. They cover what health policy is, the health policy process, health policy analysis, but also health economics. We look at different health systems around the world, we compare and contrast different features, and we also look at evaluation and research, how to evaluate different health policy initiatives and different health services. You can then choose 2 or normally 3 modules. These cover health policy, public health, social determinants of health, but also management, leadership, food policy, and a number of other areas. Finally, you've got the dissertation, choosing a topic of interest to you related to health policy, and then developing that topic in some detail, resulting in your final dissertation project. There's also a distance learning option. All of the lectures you can watch as recordings after the lecture. There'll be live, real-time, online seminars as well to supplement that material and also to ask any questions that you may have. We very much focus on practical application of health policy ideas, of theories, of concepts. The accent is then for you to apply that more theoretical knowledge to real-world problem solving. A number of our students undertake internships. We are very lucky living and being based in London that there are many health-related organisations in the city and around the city, both UK-based but also international as well. Policymaking is fairly similar wherever you go in the world. The context is different, but the process is very much the same. So what we're giving you are practical tools you can apply across the world in any country.